Would have been nice to have a video camera too, wouldn't it?
Yeah, but that standard of care is to have documentation of exactly what happens to everybody, and there was none. And so I have to use what Dr. Murray is telling me, and he said 2 minutes.
But you don't think it was 2 minutes, do you?
I think
Overruled. You may answer.
My report is based on those 2 minutes. I'm assuming it's 2 minutes.
So if it's not 2 minutes, you'd have a different answer.
It's a hypothetical to assume Dr. Murray is lying or inaccurate?
There are way too many variables. Wait a minute, please. The objection is sustained.
Well, let's assume that Dr. Murray was gone for a longer time than 2 minutes.
First of all, we're assuming he's not on a propofol drip, which we're assuming, and you're assuming all my testimony is based on what's written, that he's on a drip and that he was gone 2 minutes. You want me to pretend that those things don't happen, that he only got 25 milligrams, and I need to pretend that he was gone for more than 2 minutes. Is that right?
I'm not asking you to pretend.
No.
Have you ever made a time estimate error?
Well, you're talking about out of a hospital, in a hospital, so the court's sustaining its objection. It's vague and ambiguous.
Doctor, you know for a fact, don't you, that Dr. Murray was gone for longer than 2 minutes?
No, I don't.
Have you heard any of the phone calls that he made?
He could have made. I heard about the phone calls. I don't comment on the phone calls because I only took his words.
Okay.
So I don't comment. One, if you're telling me he was on the phone, you're giving me that information. He shouldn't have been on the phone, and it just tells me that maybe he was on a propofol infusion, because you can't talk on a phone when someone just got 25 of propofol. Why would I talk on the phone? I would wake Mr. Jackson up. So that just tells me he was on a propofol infusion. He was in the room, and again, you don't ever leave someone who got propofol. He left him unmonitored. He shouldn't have given propofol in the first place for sleep. So the answer is that could have been more than 2 minutes. I don't think it could. That's what he said. So okay. I'm assuming from my report.
So your opinion is based upon assumptions that you've made in your opinion is that Dr. Murray put him on a propofol drip.
Yes, sir.
And that Dr. Murray was only out of the room for 2 minutes.
2 minutes.
And 2 minutes before he came back, Mr. Jackson was fine.
2 minutes before he came back, he was fine, yeah.
And so Dr. Murray leaves the room to go urinate and comes back 2 minutes later. So Mr. Jackson couldn't have been having any trouble breathing or with heart function for longer than 2 minutes.
Yes, sir.
And if that's true, he was savable.
Absolutely savable.
Okay. If that's not true, and Mr. Jackson had not been breathing for an extended period of time, say 5 or 10 minutes, then he wouldn't be savable, would he?
So I have to pretend that he was? This isn't a...
No, I'm not asking you to pretend. I'm giving you a hypothetical.
You're giving me a hypothetical.
Let's assume that Dr. Murray is gone for a period of time longer than 2 minutes. Maybe it's 10, 15, 20.
At that point, he was still savable.
Wait, allow the question, please.
What is it about him that you think makes him savable?
Because he had a blood pressure. He had a heart. Remember, I was explaining the sedation, an arrest. You stop breathing. There's less oxygenation. The heart is still contracting, and there was still a blood pressure, and the heart rate was up at 122. The heart was getting excited because there was not enough oxygen in there. So at that point, he was savable. He still had a blood pressure.
What makes you think he had a blood pressure?
Because he has a pulse, and he had a heart rate on the pulse oximeter. And
finish your answer.
That's why he had a blood pressure. But it would have been nice to have a blood pressure cuff, which Dr. Murray didn't have, and it would have been nice to have all that help, and it would have been nice if you never have left him. So all those equipment and monitoring that Dr. Murray didn't have, if he would have had all that, he could have probably saved Mr. Jackson at that point, because he could have reversed the flumazenil, he could have given the bag mask, he could have gotten oxygen, and if he would have gotten oxygen within about a minute into the patient, that heart rate, that blood pressure and heart rate would have come right back up. The heart would have started saying, I have oxygen and I'm going to start to work and my heart rate's going to go down, my blood pressure is going to go up. So if he would have found him if I found him at that point, yes, he was savable.
When he found him, he may have been in pulseless electrical activity phase.
No, he was not pulseless electric. He had a blood pressure. He had a pulse. By definition, Dr. Murray checked a pulse. There was a pulse. So there's no such thing as pulseless electrical activity with a pulse.
You know, how do you know that Dr. Murray felt the pulse?
He said he wrote it down.
Well, how did he describe the pulse?
Thready.
Thready?
Mm-hmm.
What's a thready pulse?
It could be a low blood pressure.
It could be pulseless electrical activity,
No.
too, couldn't it?
Pulseless by definition is no pulse.
So you're of the opinion that if, rather than do CPR on Mr. Jackson, if you first called 911, there would have been a different result.
Yes, sir.
Once he found him not breathing, should he have called 911 first, or should he started chest compressions?
He should have never started chest compressions. He should have called 911.
How long does it take to call 911?
It takes about, I don't know, a second.
Okay, are you familiar with the 911 call that was made in this case?
I'm not familiar with it. I had listened to it 2 years ago.
Do you know how long it took?
No.
Relevance, Your Honor. It's not indicative of how long it...
The objection is sustained.
Is it your opinion that if Dr. Murray finds the patient not breathing, that he should, before trying to restore any kind of breathing or oxygen, he should call 911 before he's done any procedures whatsoever?
According to the guidelines, in an asphyxial arrest like this one, a healthcare provider like Dr. Murray is allowed to do a short test of resuscitation before calling 911.
If it's a drug-induced problem, is he given a little bit longer?
No.
Okay.
It's the standard for drowning, obstruction, and drug overdose.
Okay. How much time should he take before he calls 911
He's
to
only
make the
allowed-
diagnosis and to determine what the situation is and to assess whether he should do any emergency work? How much time would you allow him in terms of minutes before calling 911?
2 minutes.
Okay. And if Dr. Murray immediately went at, say, 12:05 to get help, is that a violation of standard of care?
Yes.
5 minutes versus 2 minutes?
Yes.
Is this something over which reasonable minds could differ?
It's pretty clear that it's 2 minutes.
So any doctor that says that he should probably try and stabilize the patient first before doing anything?
First of all, it makes logical sense to call 911. He doesn't have any of the appropriate equipment, any help. He needs to get help. You call 911 first.
Okay.
Because he obviously, waiting didn't work.
Now, you mentioned the name that you're aware of, Kai Chase.
Objection. Misstates the
I
testimony
don't
of
believe you
relevance.
mentioned that. You sustained, assumes facts, none of evidence. May I see counsel, please?
What was that last question?
Do you know Kai Chase?
Oh, yeah.
I
Oh,
sustain the objection.
you don't know the person that he asked for help for by name. Is that correct?
Objection is vague as well. We were talking about 911 calls. You know,
Sustained. Read fine, please.
From the time that he discovered him, right about 12 o'clock, is it your information that the first person he contacted for help was Michael Amir Williams at 12:12?
Yes, sir. That's what it says in his testimony, yes.
In his interview.
In his interview, I'm sorry, interview.
So you're not aware of him contacting the help that was downstairs and asking her to get help and get security?
There's a mention to it, but I think specifically, let me look here. I remember him running down, he states in his what do you call it? Interview that he runs downstairs. But I don't know if I don't remember him telling the cook or the chef to call for help. I don't recall.
Okay. Well, there's been testimony here that he did that about 12:05. That may, if that was 5 minutes afterwards, would you think that the difference between 2 minutes that you would allow him and the 5 minutes would be an egregious standard of error?
objection assumes facts on evidence. He didn't ask Kai Chase to call 911. That's not in the record.
The objection is sustained.
I wasn't assuming, Your Honor, that Kai Chase was asked to call 911.
I'm sustaining the objection to the phraseology of the question.
In the event that he did seek help, 5 minutes, approximately 5 minutes after discovering the situation, would that difference between 2 minutes and 5 minutes cause him to be an egregious standard of error?
Every minute counts. It's an egregious standard. It's a severe, extreme deviation, yes.
So if he took more than 2 minutes and it was, say, 3 minutes, that minute causes it to be an egregious deviation from the standard of care.
Yes, sir.
And so are you affiliated in any way with the Board of Medical Quality Assurance?
I don't know what that is. No, I'm affiliated with the California Board of Medicine, the Board of Medicine.
Okay, that's no longer called the Board of Medical Quality Assurance?
I'm not aware if that's what they're called.
Okay. They're the ones that evaluate conduct of doctors?
The California Medical Board?
That's